Juno, a teen pregnancy presentation by Shannon, Nicole, and Mercy.
The movie we watched as a group was the movie Juno. This movie represented a 16-year-old adolescent girl who experienced teen pregnancy.
Juno was about a 16-year-old female who became pregnant by her best friend, Paul Bleecker. She experiences family trials as well as a typical teenager bullying situations while facing being pregnant at a young age. She was given options for her pregnancy. In the end, she chose to give her baby up for adoption to a wealthy, upper-class couple. After finally being assured her life was going to be in order after her baby was born and given to wonderful parents who were named Vanessa and Mark, the adoptive parents split up. Juno's witty sense of humor did not fade during the hardships. She ended up giving her baby to Vanessa, the now single mother who wanted a baby desperately. During Juno's pregnancy, she experienced typical teenage struggles in her friendships. Her lifelong lover, Paul Bleecker, ended up being her soulmate. Right now, you're looking at issues and problems for the movie Juno. We have two categories, teen pregnancy and looking at the options. In the movie Juno, she had two options. Her first one was abortion and her second was adoption. In the movie, looking at teen pregnancy, in the movie, the primary character, Juno, experiences the issue or problem of teen pregnancy after having intercourse for the first time with her best friend, Paul Bleecker. Looking down at the options, when we discuss abortion and adoption, Juno is presented with these options, and her first option was abortion, which she wanted to choose. There was a clinic in the movie called Women Now, and the clinic was a place where she could go and have an abortion. While she was there, the girl who worked at the reception desk was asking her for her information, and she had to fill out this paperwork, and Juno became scared because after looking at the agency, the things that were hanging on the wall, and she ended up seeing a friend outside of the clinic who was not for abortion and pro-life, and she kind of said something to Juno in the beginning, and it scared Juno, so she ended up running out of the clinic, and her second option then was to pursue adoption, which she chose. Scholars agree that teenagers do not have the cognitive ability to evaluate their options and decisions clearly. This is not for all teenagers who are pregnant, but mostly during their research they found that was true. This was represented in the movie by Juno when she went to the Women Now clinic, as we discussed, to get her abortion, but because of fear, anxiety, and change of perspective to the action she was going to take before, she chose to adopt. Adolescents do not necessarily possess the cognitive ability needed to clearly evaluate such a situation or to determine how to resolve their pregnancy. That was said by Yin and Lam in an article that we had found. Finally, Juno decided to choose a capable and hardworking environment for her child. She looked in a newspaper article and found Vanessa and Mark, who were in a wealthy upper-class community. Leah, her best friend, saw the ad with her, and they both decided that that would be a good picture-perfect family for them to have, for Juno to give them the baby.
Slides is the motto systematic analysis. We will look at the youth, the family, the environment, and the society.
Category we're going to look at is the youth. Juno is a 16-year-old female who became pregnant after her first time being sexually active. Juno's at-risk population is teens who are experimental sexually. Juno's developmental life stage is adolescence. We're going to look more into identity development as well as internal risks and protective factors. The author Hutchinson of a Human Behavior textbook said that in adolescent middle stage was where Juno was. She was 16 years old, and during this time frame, adolescents undergo various changes. These changes include, but are not limited to, biological changes such as completion of puberty and physical appearance changes, psychological changes including reactions to physical changes, and social changes, which in middle adolescence focuses on peer relationships and begins one-on-one romantic relationships. Hutchinson also identifies areas of growth in adolescence to help researchers identify youth and help populations who may be at risk. Looking more into identity development, Morris Rosenberg wrote a novel, Conceiving the Self, and Hutchinson uses Rosenberg's motto of identity to further research. There are 3 stages the researcher analyzes: social identity, dispositions, and physical characteristics. With relevance to the movie Juno, the social identity section refers to the term labels. The example for labels is identifiers that result from social labeling, as when the boy who skips school becomes a delinquent. This ideal of labeling compares to the labeling peers were placing on Juno when her pregnancy furthered. The characters in the movie did not use words such as slut or inadequate mother. However, in youth culture, these labels can be stigmatized on adolescents who become pregnant. Next is the family context. Juno has a supportive best friend named Leah. Juno's father and stepmother are highly supportive, financially, medically, and emotionally, as well as indulgent parenting style, which we will look more into. Juno was hesitant in telling her father and stepmother about her pregnancy. Her best friend Leah was there as a support. Just as any teenager would be fearful of telling her parents or guardians she's pregnant, Juno had the same feelings. After finding the courage to share her news, Juno's father and stepmother were proactive in getting Juno help. To continue, we will look into indulgent parenting. Laser and Nicotera refer to a specific parenting style as indulgent. This parenting style demands little of the adolescent, as well as giving the adolescent freedom in her choices. Although their parents are like this, the parents are also warm and responsive when necessary. For example, when Juno shared she was pregnant, the parents made jokes about how they thought she had gotten expelled and did not react in an angry manner. The parents had less sense of direction, so they allowed Juno a lot of freedom during her adolescence before she was pregnant. This was not the parents' fault, just to make that clear, but it was the choices of Juno. They also allowed her freedom while deciding what to do with her pregnancy, whether she wanted an abortion or to proceed with adoption.
Like we look at the environment Juno lived in. School. Before Juno was pregnant, she was relatively introverted, despite her witty humor. She had two best friends, Paul Beckler and Leah. She was not involved in school activities. She did not value hard work in her academics. For example, Juno was in a group project in her science class with Paul and was not self-sufficient in her academic work. She copied Paul's homework. Teen pregnancy bullying. According to Herna et al., helped readers understand the impact of teen pregnancy bullying. Juno went through a lot of bullying throughout her pregnancy in school setting. This article talked about the intervention techniques that address the social disadvantages associated with parenthood and assess the appropriateness of such interventions for young adolescents. In context, the school was aware of Juno's pregnancy. During the movie, the office secretary was shown signing a note for Juno to leave in school to go to an ultrasound appointment. In real-life setting for a teenager, a school system would have to accommodate teens who are pregnant. This could include appointments, multiple visitations to restrooms, which requires leaving class, as well as counseling services for possible stigmas directed towards the pregnant teen.
Next, we are going to go into the neighborhood community of the movie Juno. The neighborhood dynamic was not defined. It was unclear if her neighborhood was supportive or involved in her life. For example, in the beginning of the movie, after Juno found out she was pregnant, she went to a convenience store and bought her third pregnancy test. The store clerk was picking on her because Juno was hesitant to believe after the third test that she was really pregnant. She seemed to have good, supportive relationships with the store owner. Lasher and Nicotura 2011 defined community as 4 generalized categories. Her economic composition involved home ownership by her father and stepmother. In the social processes section, it points out unsupervised teens. This was shown in Juno's neighborhood because Leah and Juno had the freedom to do as they pleased. Even though there was freedom in their choices, the girls still had values which were shown in Juno's actions while she was pregnant. In context, the community was aware of Juno's pregnancy. Like we said up top, the convenience store owner, Paul Bleeker's mother, the adoptive family, and medical assistants were aware. The ultrasound technician depicted in the film created a negative stigma on pregnant teens. When Juno was at her ultrasound appointment, the woman doing her ultrasound appointment had negative nonverbal language as well as made inappropriate comments directly toward Juno while getting her ultrasound. These comments showed her unwillingness to work towards supporting the decisions of pregnant teens.
The society. The social aspect of pregnancy teens shows the experience bullying. For example, in the movie, Juno was experiencing dirty looks from peers and staff. The students did not want to interact with her due to her failure in their perspective.
The next aspect of society is cultural. Juno was a Caucasian female. It did not seem her family valued sex before marriage. However, Juno being pregnant did not cause disgrace upon the family or discord among family members. The family accepted her and supported her through her pregnancy, which is not typical for some cultural backgrounds. Cultural for pregnant teens is the next part we'll talk about. Sunny Press conducted research that supports the movie Juno. It references teenage parenting abounds in mainstream culture. This article talks about teenage pregnancy and parenting in relation to the construed social problems associated with culture. Likewise, the movie relates to the article when it portrays the family supporting Juno. The family did not show disgrace in Juno's actions, but embraced Juno's reality of being a pregnant teen. The family then managed to make a list of ways in which to solve the problem by ensuring Juno that she would get quality care such as vitamins, appointments, etc. for the pregnancy.
Next is political. What service do pregnant teens need? As our group was researching teen pregnancy, we decided these services could be used for pregnant teens. WIC, counseling services, food stamps, Medicaid, cash assistance, employment services. Juno was given financial assistance by her parents. The stepmother made a comment about Juno needing prenatal vitamins. She took her to her ultrasound appointments. The stepmother also made sure Juno was eating healthy. This was proven to us by a conversation between Juno and a potential adoptive parent, Mark, when Juno told Mark her stepmother was making her eat healthy. During the beginning of the closed adoption process, Vanessa and Mark offered to pay for all of Juno's medical expenses.
Researchers Akella and Jordan 2011 stated a child having a baby as a teenager is more likely to face critical social issues like poverty, poor education, risky behaviors that lead to poor health issues, and child welfare. This quote portrays teenage pregnancies in a negative way. However, there is truth in their baby's future. This is not the case for all pregnant teens. There are many teenage mothers who have a child and provide adequate, safe, and assuring futures for their infants, but there are risks for the infant when born.
Economic attitude. Juno's pregnancy was not affected by the economic because she is dependent on her father and stepmother. She was a part of a middle-class family in a safe neighborhood, which provided a satisfying environment for her to live in. Juno did not need economic assistance during her pregnancy.
Finally, we will look at values and beliefs. Juno's situation presented options, and she decided to keep the baby, which showed she valued life versus termination at the point when she chose adoption. Juno values healthy relationships. She was frustrated with Paul Bleecker when he was not giving her affection during the pregnancy. All of these societal effects have influenced Juno's decisions with her pregnancy as well as her personal life choices.
When examining the possible causes for teen pregnancy, it is important to consider the factors. Approximately 74 to 95% of adolescent pregnancies are unexpected and unplanned. While media venues, such as TV shows, depict sexual acts regularly, there is very rarely any informative or preventative nature to the content. American teenagers also tend to experience sexual behaviors at younger ages and with more partners than other industrialized countries. Further, 66% of teenage females who become pregnant have experienced a history of sexual abuse. It is imperative to keep these factors in mind as it allows social work practitioners to have some perspective as to the possible causes for risky sexual behaviors in adolescents. Practitioners can then explore these factors with adolescent clients to promote healthier choices. Utilization of evidence-based programs can have positive implications for lowering teen pregnancies and other undesired behaviors and outcomes for this age bracket. For example, the Safer Choices program is an evidence-based practice aimed for high school youth with the mission to reduce the frequency of unprotected intercourse through reducing the number of students engaging in sexual relations and increasing the use of contraceptives by those who continue to engage in such behaviors. This program is meant to be implemented within the school setting, which would assure consistency for all adolescents within the community that attend school on a regular basis. McCabe discusses several elements which contribute to having a successful teen pregnancy prevention program. Number 1. Offer simple information on the risks of sexual activity, information about and access to contraceptives, and how to prevent sexually transmitted infections, or STIs, and ways to avoid sexual situations. Number 2. Utilize techniques which promote healthy behaviors. Number 3. Conduct activities which demonstrate pressures, such as societal pressures and peer-related pressures, that can influence decisions to engage in sexual behaviors. Number 4. Practice and teach communication, negotiation, and refusal skills. Number 5. Engage with the adolescents and make the sessions personalized. Number 6. Utilize behavioral goals, teachings, and content catered to the age, sexual experience, and cultures of the audience. Number 7. Have the sessions timed out appropriately to meet the needs of the group. And finally, number 8. Use staff who are trained and truly believe in the efficacy, mission, and impacts of the program. Having buy-in from the community is imperative for facilitating successful interventions. The visual depicted here was created by Duffy, Prince, Johnson, Alton, Flynn, Fay, Paget, Rowlandson, Becker, and Hinsey for use of implementing a teen pregnancy prevention program in South Carolina. However, the research they conducted has worth for use in other communities as well. I have created a key of all acronyms below for easy comprehension of the diagram. The diagram depicts various levels and influences on the program implementation process. To start, community partners build their capacity by using the Promoting Science-Based Approaches Getting to Outcomes model to plan, implement, and evaluate teen pregnancy prevention efforts. Then, the program would work to build their own capacity and provide support to local partners using the Promoting Science-Based Approaches Getting to Outcomes model. Finally, the Promoting Science-Based Approaches Getting to Outcome model is fully developed to provide a systematic process for local partners to use a science-based approach in their teen pregnancy prevention work. These steps can flow through one another with influences and considerations from funding, macro policy, climate, and existing research and theory practices. Duffy et al. Discussed how using the Getting to Outcomes model, which focuses on planning, implementation, evaluating, and sustaining programs, can assist communities in successful execution of science-based approaches. Throughout their research, it was found that the organizations who utilized the Promoting Science-Based Approaches Getting to Outcomes model had positive outcomes such as noted increase in the number of local organizations and successful implementation of science-based approaches. This research provides a framework for social workers to move forward in macro-level practice. With this model in mind, social workers within a variety of communities could look at more efficient and effective implementation of prevention programs for at-risk adolescents engaging in or contemplating sexual behaviors. As social workers, we must be cognizant of potential ethical concerns which can arise during practice. In examining teen pregnancy, there are several ethical considerations. Teen pregnancy can result in negative outcomes for all parties involved. Due to teen parents often not reaching high levels of educational attainment, job opportunities are often limited, which can result in chronic poverty. There are also concerns regarding the health of infants born to teenagers. Oftentimes, these infants are born preterm, have a low birth rate, and are 3 times more likely to die during infancy. Infants born to adolescents are also more likely to be victims of childhood maltreatment than those born to adults. These factors are important for consideration as teens who are struggling with what to do when pregnant may not be aware of the possible future implications of deciding to keep the child. Social workers should seek to provide this information to communities for preventative action and should also assure adolescents who are already in a teenage pregnancy situation are aware of these potential consequences as well. Attention must be given to the rates of teenage pregnancy among various races and ethnicities. There is an unbalanced number of these pregnancies affecting African Americans and Latinas. National statistics suggest that 1/3 of all teen women become pregnant before the age of 20. However, this number increases to 50% for African Americans and 52% for Latina teens. Social workers must work to address this gap and seek to improve services for these exceptionally vulnerable groups. Given the various budgetary constraints within the American government, it can be difficult to obtain funding for human services. This is evident in the lack of monetary allocation for sexual health services. Lack of funding has resulted in an inability for expansion of family planning clinics, especially within rural areas, as well as a high rate of turnover for clinic employees. However, this consistent lack of funding may be resulting in more costs for the United States when considering that in 1994, $34 billion were spent on costs for teen pregnancies, such as health care, assistance benefits, and food stamps. Based on suggestions from social cognitive theory, media can affect how adolescents interpret appropriate versus inappropriate societal behaviors and norms. While it is evident that the media is constantly pushing sex onto Americans through platforms such as television, magazines, and fashion, sex is still considered a taboo topic to discuss. Hust et al. Discussed that U.S. parents often struggle and feel uncomfortable talking to their children about sex. This stigma regarding the normalization of sex in American society may be contributing factors to why the U.S. has the highest rates of teen pregnancy, births, abortions, and sexually transmitted infections, or STIs, of all the industrialized nations. It is imperative that social workers advocate for legislative changes to promote increased budgets for family planning services. Furthermore, consideration must be given to the changing values, attitudes, and beliefs surrounding the sexual stigma in the U.S., as research has proven that countries which have normalized these discussions and services, such as the Netherlands, have much lower rates of teenage sexual issues. Overcoming ethical dilemmas is something all social workers must become accustomed to. There are many ways in which to do so, however, we wanted to highlight a few key messages for the purposes of our specific scenario and identified population. Social workers must take on the role of being educators at times. It is important for social workers to provide education to adolescents, families, and the community regarding the impacts of teen pregnancy. Social workers must also participate in awareness by bringing attention to societal issues and populations at risk. By acknowledging the disparities among cultures and race with regard to teen pregnancy, these gaps can be further researched and assessed in order to reduce the risks among vulnerable populations. It is critical for social workers to engage in advocacy to effectuate positive change. Becoming active within the community and government can assist in acceptance of the issue, and thus more funding could be allocated for services to address the need. Through utilization of engagement skills and reliance on the NASW Code of Ethics, we as social workers can provide quality services to adolescents which will have positive ripple effects for families and communities alike. Now that you have hopefully acquired an increased knowledge about the needs of pregnant and sexually active teens, We encourage you to become involved in working toward addressing the gaps still in existence today. Thank you.
Mercy, Nicole, and myself, Shannon, have used scholarly academic journals to help benefit our research on teen pregnancy. We also use the Code of Ethics, as well as the movie Juno itself, and other resources to help us better understand teen pregnancy as a societal and cultural issue.
Thank you for viewing our PowerPoint.